Ladies and gentlemen, welcome to MedSynapse Specialist Podcast Series. Today, we will be having an important topic to cover on the subject of reproductive immunology and the role of lymphocyte immunization therapy in reproductive failures. Joining us today to discuss this topic is our esteemed guest, Dr. Mohan Raut, consultant obstetrician and gynecologist, clinical reproductive immunologist recognized by American Society by awarding fellowship in clinical reproductive immunology. He is the founder of Dr. Raut's Center for Reproductive Immunology and Dr. Raut's Maternity and Surgical Nursing Home, including setting up India's first immunotherapy center. He is also involved in important research with institutions like Oxford University. Dr. Mohan has authored the groundbreaking book Lymphocyte Immunization Therapy in Reproductive Failures, New Horizons, published by Springer Nature. He also serves as the guest editor of the American Journal of Reproductive Immunology and editor of the Evidence-Based Women's Health Journal. Welcome, Dr. Mohan.
Thank you so much, Dr. Nigar, for this kind introduction. And thank you so much, MedSynapse, for inviting me to this special program, The Specialist, to speak on the subject of lymphocyte immunization therapy and its role in reproductive immunology.
Thank you so much for being here with us today on this important topic. Before we begin, I would like to ask you one question. What sparked your interest and led you to specialize in the field of reproductive immunology?
Nice question, Dr. Nigar. My encounter with reproductive immunology started more than 30 years back. It was a research project from the Oxford University on role of lymphocyte immunization therapy in repeated miscarriages. It was a double-blind study, very interesting. After the study was over, I continued to work in the field of reproductive immunology and lymphocyte immunization therapy with my wife, Dr. Mugdha, and now we have 7 reproductive immunology centers and more are in the pipeline.
Thank you so much for sharing your personal journey into reproductive immunology. It's truly inspiring. Now let's dive right in. Dr. Mohan, can you explain the concept of reproductive immunology in simple terms and its significance in managing fertility issues?
The immune system of our body, the function of the immune system is to protect against any invader. It defends our body against a wide range of pathogens, including bacteria, viruses, and other microorganisms. It is composed of cells, tissues, and organs that work together in defense against these foreign invaders. Yet, this immune system is overcome in mammals in pregnancy, where the fetus grows in the mother's body. And indeed, pregnancy is nature's miracle. And this is apparent when you look at the immunological aspects of pregnancy. A pregnancy has 50% genetic material from the father and 50% from the mother. The paternal part of the fetus, it carries the paternal antigens, and these antigens are totally foreign to mother's immunological system. So logically speaking, the mother's immunological system should build an immunological reaction against the fetus, leading to rejection of the fetus. But this does not happen. The fetus survives and grows into a healthy baby. And this is known as paradox of pregnancy, and it has always been a challenge for reproductive immunologists. In fact, it was Sir Peter Medawer, who is considered as the father of reproductive immunology, has put forward this question for the first time in 1953. How does a pregnant mother sustain a fetus which is antigenically foreign body for several weeks and months in her body? So this has led to the research in the field of reproductive immunology, and various treatment modalities are advised, including lymphocyte immunization therapy.
It's truly eye-opening to grasp how our body's defenses can impact the fertility and how your work can address these concerns for hopeful couples. Moving on, what are the key immune factors that play a role in reproductive failures and how do they impact fertility?
I think very good question. For protection of normal pregnancy, immune system plays a very important role. There are 3 immune factors that are important for pregnancy protection. The first one is Th1, Th2 balance. The immune system has two types of responses, the inflammatory and the anti-inflammatory. The inflammatory response, it is required for destroying infection and other pathogens, while the anti-inflammatory response is very important to protect our own body from immunological attack, that is autoimmunity, and also for protection of pregnancy. So this is called as Th1, Th2 balance, and it is important for protection of pregnancy. The Th1 cells produce Th1 cytokines, which are inflammatory in nature, and Th2 cells produce Th2 cytokines, which are anti-inflammatory. And this balance is very important. Increased Th1 response or activity leads to reproductive failures. Second mechanism is the Th17 T regulatory balance. And increased Th17 activity leads to pregnancy failures, while T regulatory cells protect the pregnancy. The third immune factor is the role of natural killer cells. They play an important role in allorecognition process. They have inhibitory and activating receptors, and if the inhibitory receptors are stimulated, there is allorecognition and protection of pregnancy, and any abnormality in these mechanisms will lead to reproductive failures. Depending on at what stage these mechanisms act, we can either have implantation failure or a miscarriage.
Dr. Mohan, could you please give our listeners a brief overview of what lymphocyte immunization therapy is and how does it work?
Great. I think we are coming to our main topic of the talk, and lymphocyte immunization therapy or LIT. It is use of lymphocytes for causing immunomodulation, and it is an active immunotherapy or active immunomodulatory treatment. It was the first treatment that was recommended for patients who had unexplained repeated miscarriages, and it involves basically separation of lymphocytes from the blood of husband or donor and injecting them into wife to cause immunomodulation. The principle here is to use allogenic lymphocytes to induce immunomodulation. Now coming to how does it act? That's the next question. I think it is how the lymphocytes have immunomodulatory activity, and it is due to a surface marker called as CD200. So when lymphocytes are injected into the skin, they are picked up by the dendritic cells in the skin and they are presented to the immune system of the mother, and there they stimulate the B cells and T cells. Stimulation of B cells leads to production of antibodies which are protective. They are called asymmetric antibodies, while stimulation of T cells leads to T regulatory cell formation, which are also protective in nature. An important thing here to remember that only freshly separated lymphocytes have the immunomodulatory activity. The CD200 surface marker required for immunological activity is destroyed if the lymphocytes are used from stored blood. Here I would like to mention that the LIT procedure that is done at our centers is done by a patented process. It's a one-time 3-hour process, and the couple is asked to plan pregnancy 4 weeks after LIT, and the effect of LIT lasts for almost 18 months after that.
How does lymphocyte immunization therapy work in treating recurrent miscarriages and implantation failures?
So, in patients who have repeated miscarriages or recurrent implantation failures, there are various causes. And if we investigate these couples for those known causes, it has been found that almost 50% of couples have all the reports normal. And it is in these so-called unexplained miscarriages or implantation failure or IVF failures that the immune system plays an important role, causing the reproductive failure. So it is these patients which are benefited by immunomodulatory treatment with lymphocyte immunization therapy.
It's exciting to see advancements like this that target immune factors have the potential to improve the fertility outcomes. Now, moving on, what are the selection criteria for patients who could benefit from lymphocyte immunization therapy? And are there any specific conditions that make it more effective?
Yes, this is the most important question, I will say, of this entire talk. So there are 4 groups of patients who are recommended LIT. So these groups are unexplained repeated miscarriages, unexplained recurrent IVF failures or implantation failures, unexplained infertility, and the 4th one are certain cases of unexplained late pregnancy loss like early onset severe preeclampsia with intrauterine fetal death. The success of LIT procedure lies in proper selection of the couples, and LIT is beneficial for this properly selected subgroup of patients, and many studies have proved that. There are no specific conditions that will make it more effective, but proper selection is the key for success.
How does lymphocyte immunization therapy differ from other immunomodulatory therapies used in reproductive medicine?
There are different types of immunotherapies or immunomodulated treatments that are used in patients who have reproductive failures. So in case of immunological reproductive failures, different immunomodulatory treatments that are used are mainly of two types. Apart from lymphocyte immunization therapy, there are intralipid, intravenous immunoglobulins, steroids. The essential difference between LIT and the other treatments is that LIT is an active immunomodulatory treatment, while the other medications are passive immunomodulators. The active immunomodulation means the treatment acts on the patient's immune system, and then the patient's immune system generates the protective response. The lymphocytes injected in the LIT procedure, what they do is they induce production of protective antibodies and cells. And this creates an environment similar to that is seen in normal pregnancy. While in passive immunomodulatory medications, what happens is they directly prevent the immunological effect on pregnancy. So the protection of LIT mimics natural protection. So it is long lasting compared to the passive immunomodulation. Also, LIT is much more safer than passive immunomodulatory medications. So many times, passive immunomodulation alone, if it is used, it may fail. But it gives the best result when it is used after lymphocyte immunization therapy. We have seen this very often. Here I remember one of our patients, this patient had 5 IVF failures. She even had taken passive immunomodulation during the last 3 cycles, but the IVF had failed. One lymphocyte immunization therapy procedure at our center, followed by the required immunomodulatory medications, helped her to succeed in the next IVF cycle. So that much importance is there to LIT and the immunomodulatory medicine.
As a reproductive immunologist, what precautions or potential risks should be considered when administering lymphocyte immunization therapy to patients?
This is also a very important question because very commonly asked by patients as well as doctors. So it is very important to be extremely careful while administering LIT. We advocate 5 steps. First is adequate counseling. Second is proper selection. Third is careful cell preparation. Fourth is correct administration of injection. And fifth is right follow. In the first step of counseling, we give all the correct information to the couple with all pros and cons. Then comes the proper selection with immunological tests. Third step is cell preparation, and this is done with a patented process. Use of optimal number of cells is very important. And the correct administration of injection is very crucial with all aseptic precautions, and finally a proper follow-up that the patient is taking the right immunomodulatory medications is crucial. So this is because use of required immunomodulatory medications are very important after LIT for success of the process.
Now, moving on, can you discuss the success rate of lymphocyte immunization therapy in comparison to other established treatments for reproductive failures, and also in which scenarios it might be a preferred option?
Right. So the success rate of lymphocyte immunization therapy has been discussed in many studies. Various studies have shown success rate between 75 to 85% in properly selected subgroup of patients. Meta-analysis of newer studies published in 2021 has also shown odds ratio of more than 3. That is, it indicates that LIT is more than 3 times effective in those patients compared to those who have not taken LIT. So it is important to note that the investigations and treatment of reproductive failures, recurrent pregnancy loss and RIF are very exhaustive and very time consuming. And in the end, in almost 50% of patients, we don't find any cause. So if the diagnosis of immunological problem is done earlier, a lot of trouble can be saved. So LIT is always a preferred choice in unexplained miscarriages or IUI or IVF failures. In fact, we don't do IVF at our reproductive immunology centers, but our referring IVF centers have informed us that their patients' success rate has been between 75 to 80%, which is quite significant.
Are there any specific diagnostic tests or immunological markers used to assess the need for lymphocyte immunization therapy, especially in patients with recurrent reproductive failures?
Again, this is very important to understand and know, because for success of lymphocyte immunization therapy, as I mentioned before also, proper selection of couples is very important. This selection is based on certain immunological tests. And which are these tests? So the important investigations which we recommend are lymphocyte cross-match, natural killer cell estimation, third is TNF alpha estimation, and fourth endometrial CD57. We also advise anti-thyroid antibodies. Now lymphocyte cross-match, it is done to detect the asymmetric antibodies which are protective antibodies. A negative cross-match suggests absence of these antibodies and it indicates that LIT will be beneficial for that couple. Increased NK cell activity is also associated with reproductive failures. Increased level of TNF alpha, which is an inflammatory cytokine, is commonly seen with reproductive failures. And the fourth test, which I mentioned, is estimation of cells called CD57 in endometrium. And these cells are highly toxic to pregnancy and they are not normally present in endometrium. So their presence in endometrium indicates an immunological problem and they require LIT. The other tests that are used are Treg cell estimation, where low levels are associated with reproductive failure, or Th1 Th2 cytokine ratio, or KIR genotype on NK cells, HLA sharing, etc. But of course, the most important thing here to remember is that to rule out all other known causes of reproductive failure. Here I remember one more patient of ours from Ireland. She had 15 miscarriages. She inquired with us whether LIT will be beneficial for her. We asked her to do the investigations. The investigations indicated immunological problem and she had successful pregnancy after LIT. So investigations are the most important and they are key to success.
Dr. Mohan, I'm interested to know how you handle patients who might be hesitant about immunotherapy as a treatment option.
I think this is very commonly encountered by us and it requires a lot of efforts from our side with these patients. Whenever we recommend immunotherapy or lymphocyte immunization treatment, the couple has many questions and that is natural because LIT is a type of immunotherapy, as I told you. So they are worried whether there will be any side effects on the patient, any problems during the pregnancy, or any adverse effects on the baby. So we do a thorough counseling of the couple and give them all the information about LIT. How does it work? How it is given? What are the chances of success and whether there are any side effects? Very important. We tell them that LIT does not suppress immunity, which does not make her prone to any infections. There are no severe allergic reactions like anaphylaxis. There is no risk of delayed complications like autoimmunity or graft versus host disease as seen with other immunotherapy procedures. So it's a safe procedure.
Now, considering the complexities of the immune system, how do you tailor lymphocyte immunization therapy treatments for individual patients, and what factors influence the treatment plan?
See, LIT treatment is not for all patients with reproductive failures. It is very important to understand. So, as mentioned before, proper selection of couples is very important. Then LIT is the first line of treatment for these couples. Depending on the immunological investigations, the post-LIT protocol is always individualized. Sometimes patients come already pregnant with history of previous multiple miscarriages. That is, in such cases, if the reports indicate, we give lymphocyte immunization therapy even in pregnancy and it is equally beneficial. We had one patient who had 6 unexpected miscarriages and she was just pregnant. And we explained her about LIT and she said, "Doctor, please don't wait. Do you want me to abort once more?" So her investigations indicated immunological factor and she was benefited by the LIT process. And yes, in some cases where husband is unable to give blood, lymphocytes from blood of tested donor can also be used.
Lastly, can you share some insights into the potential cost effectiveness of lymphocyte immunization therapy compared to other fertility treatments in the long run?
Again, this answer to this question is very important to understand by everyone. LIT is definitely a cost-effective treatment. It should be the treatment of choice in patients who have miscarriages, IVF failures, infertility, where the cause is unexplained. Usually, such patients are offered IVF treatment, but they are likely to fail if the underlying cause is immunological. Here, I would like to mention that the cost of LIT is 1/3 to 1/5 of that of an IVF cycle, and considering the cost of repeated IVF cycles, LIT is cost effective. One more point I want to make is LIT can be offered after unexplained IUI failures also before advising IVF treatment. We get so many patients who ask us why LIT was not suggested to us before. It would have saved us so much of trouble, and we have succeeded now with LIT. I remember one patient who had 6 IVF failures, and she came to us and we gave her LIT, and she was to take IVF again after 2 months. In 2 months, she called up and she said, "Doctor, I am pregnant," and without any treatment. So that is the power of LIT. So in the end, I would like to mention that lymphocyte immunization therapy is a great treatment. It's an immunomodulatory treatment which is very safe, very effective, and but proper selection of couples by doing the right immunological test is very important. Thank you so much.
Dr. Mohan, thank you so much for sharing your expert knowledge on lymphocyte immunization therapy today. Your insights have ultimately provided a deeper understanding of this interesting field. And thank you to our listeners for joining us. Remember, this podcast was brought to you by MedSynapse, a platform where medical professionals connect, collaborate, and learn from each other globally. Become an active member on MedSynapse to engage with experts like Dr. Mohan and contribute to advancing medical knowledge. Until next time, goodbye and take care.